Hey, Suzanne here with Caregiver Haven and Patient Fast. I just want to go over one quick tip with you today about when you walk into the doctor's office and you're sitting there in the waiting room and then somebody comes to the door and calls your name. Do they introduce themselves? First of all, rule number one, this is common courtesy. They should introduce themselves. All my nurses, all my CMAs, always, it was a requirement that they introduce themselves and let them know what their position is there in the office. Just common courtesy. All my nurses and CMAs did this. The second thing is, when they take you to the scale and they weigh you, make sure you put down your things, and hygiene just dictates that you don't take off your shoes. Do not stand on that scale with bare feet. You do not know, and I do not want to tell you what I have seen in terms of the feet that have gone on that scale. So always keep at least socks on, and preferably your shoes. I don't think your shoes weigh 10 pounds. Okay, next, you're going to be led into the exam room. At this time, if they have not introduced themselves, it is time for you to ask who they are and what their position is. And here's why this is so important. Let's say that they came in and they took a piece of paper from you that you brought in, or you told them something and then they told you that perhaps you should try this or that. They go out of the room because they're going to go room another patient. In the meantime, the physician assistant, or the nurse practitioner comes in. Now you're discussing what just went on with that person, and they do not know that person's name. Especially if that person has walked out with that piece of paper, your physician has to go find that person who is probably by then in another room, and it will take 10 to 15 minutes to figure out when a staff has 10 to 15 CMAs and nurses on it. Who was the one that roomed you? So please, always get the name of the person that is rooming you. Introduce yourself, have them introduce themselves. Take care, that's a tip of the day, and it'll save so much time and so much aggravation. Appreciate you guys. We'll talk soon. Bye-bye.